What is the treatment for broken tooth? Can we fix the broken part of the tooth back to its original position? If, due to any injury or accident, a tooth comes out as a hole, can that be fixed back? Is any treatment possible if we do not have the broken tooth with us? Is it okay to leave the fractured tooth as it is without any treatment? When not to get the broken tooth fixed back? Many such questions will be answered in this video. Friends, I can assure you all that this video will be a one-stop solution to all your questions regarding fractured or broken tooth. So stay tuned till the end. Tooth fracture is a very common accident that one can face anywhere and anytime. During such misfortune, how can we help ourselves and our surrounding people? Well, I am here to talk about all that. Hello friends, I am Dr. Akash Shah, and in this video, I'll be talking about the treatment for broken tooth with the help of my cases. But before we begin, if you have not yet subscribed to my channel, then kindly press that subscribe button, and to receive the notifications of my videos, hit the bell icon. One day, I got a call from a patient. He asked me that, "Sir, my son Yash fell down while playing and got his front tooth broken. So what shall I do now?" To that, my first question to him was that, "Sir, do you have the broken tooth with you or you have thrown it away?" He replied, "Sir, currently we do not have the broken part of the tooth with us, but I guess it might be there where Yash fell down." I asked him to look for the broken part of the tooth, and if found, bring it along while coming to our clinic. So friends, the main object of this video is to inform you all that never throw away the broken part of the tooth or whole tooth that has come out during any mishap. In 70 to 80% of cases, we can fix it back to its original position. Now, what shall be done with this broken tooth? First and foremost, clean this broken tooth with saline solution. Saline can be easily available in any medical store. And after cleaning it with saline, try to reach your nearest dentist as soon as possible. By when shall we reach the doctor? Ideally within 20 to 60 minutes. The next question that arises is, how shall we carry this broken tooth? By holding it in a hand or by wrapping it in paper? The best way to carry this broken tooth is by keeping it in our saliva. That is, in our mouth itself. But due care and precaution should be taken that this tooth should not get swallowed. Why in mouth? To prevent it from getting dehydrated or too dry. That might adversely affect the treatment. If due to any injury there is bleeding from mouth, then bite on a clean cotton, gauze or clean cloth to control the bleeding, and also apply ice pack externally to prevent or reduce the swelling. And if it is not possible to keep the tooth in mouth, then you can also keep it in saline itself or in cold milk. Let's get back towards the case. The patient who had called me came with their 12-year-old kid Yash, who had got his front tooth broken. Fortunately, they also had the broken part of the tooth with them. So firstly, we cleaned the injury site, we controlled the bleeding, and took some necessary x-rays to check the condition of tooth and bone. After that, with the help of some dental materials, we fixed this broken tooth back to its original position. The treatment hardly took about 10 to 15 minutes. After completion of treatment, Yash got his lost smile back. That made my staff and me happier than him. Some of you might be interested in knowing that exactly what material I had used in this case. In this case, I used dental cement-like materials which are known as composites. Sometimes, due to any accident or fall, a tooth may come out as a hole. This condition is known as avulsion. This avulsed tooth can be fixed back with the help of wires or any other splinting materials. We keep the tooth splinted for about 3 to 6 weeks. And once the tooth gets fixed, we remove the splinting and do some necessary treatment like root canal treatment and try saving this tooth as well. Friends, I would like to share with you all very interesting and fascinating case regarding avulsion. A patient came to a clinic to get her avulsed tooth fixed back. As she had travelled to a clinic from a different city. It took her 3 to 4 hours to reach us. I explained her that after such a long duration, the prognosis of the treatment was very poor and questionable. She told me that, "Doctor, even if there is 0.1% chance of survival of my tooth, then please go ahead with the treatment. I know that you will try your best for me." Such level of confidence and trust of patients on doctors boosts a different morale among doctors. And same happened with me. So in this case, firstly, I did root canal treatment of the avulsed tooth outside the mouth and then splintered this tooth in the mouth. I explained the patient that I have tried my best and simultaneously asked her to be ready for implants after 3 to 6 weeks if at all needed. Friends, I am happy to share that by God's grace and by patient's right care, the tooth is still going strong for more than 3 years now. This video will be incomplete if I do not share the next important case with you all, which will give you very important information. A patient came to us with pain in his back tooth. During history taking, he told us that he was trying to open a cold drink bottle from his back tooth. On examination, we saw that one of his back tooth, that is molar, was completely cracked through and through due to excess pressure while opening the bottle. And hence, we were left with no option but extracting or removing this tooth. Friends, our each and every single tooth is very precious. Kindly do not use your tooth or your teeth as bottle opener or for biting or breaking any hard objects like walnut shells as shown in many advertisements, as this might lead to some permanent, irreversible and irreparable damages. So far, I have explained you when and how to get a broken tooth fixed back. But knowing when not to get it fixed back is equally important. If due to any accident or trauma, a milk tooth comes out as a hole before the right age, then kindly do not get this tooth fixed back, as the roots of this tooth can get permanently fused with the bone and might create a problem for eruption of permanent tooth. This condition is known as ankylosis. The information about the right age of falling of milk tooth and eruption of permanent tooth is easily available online. If you still want me to share this information, then kindly comment below and I shall share an image regarding the same on my Facebook page, Dr. Akash Shah. In my previous video, many viewers had asked that is any treatment possible if we do not have the fractured or broken tooth with us? The answer to this question is yes. Depending upon the severity of fracture, treatment plan and material varies. For example, if the fracture is restricted to first 2 layers of your tooth, that is enamel and dentine, then we can treat it with the help of composites, veneers or crowns as the case demands. If the fracture extends up to the pulp or nerve of your tooth, then we can go for root canal treatment followed by crown. In some cases, the fracture may seem restricted to enamel or dentine, but the tooth gradually starts turning darker or turning black. In such cases, we can go for root canal treatment or bleaching or both with or without crown as per the case. And finally, if the fracture is extending through and through like that bottle opener case, or if the tooth is completely missing, then we can go for dental implants, dental bridge or removable dentures. During major functions or life events like marriages, we can go for immediate replacement of missing tooth with a temporary tooth for aesthetic reasons. Dear friends, I have shared very important treatment plans with you all, but these treatment plans are neither exclusive nor universal, and the exact treatment depends upon the clinical situation and clinical judgment of your dentist. Coming towards the last part of this video, I would like to answer another important question, that is it okay to leave the fractured or broken tooth as it is without any treatment? One of my patients ignored his fractured tooth for about 5 to 7 years as he had no pain. He came to us when he noticed that his fractured tooth was gradually turning darker. In X-ray, we found a very big lesion and a lot of infection that was not only damaging the fractured tooth but also damaging the adjacent healthy teeth and the surrounding bone. And friends, it took us about 2 years and multiple surgical and non-surgical treatments to completely get rid of this infection. And the healing is still going on. So friends, I strongly advise you not to ignore your fractured tooth and schedule an appointment with your dentist as soon as possible. And if your dentist and you are okay with no treatment, then you can wait and watch. But of course, under regular supervision of your dentist. That's all for today, friends. I hope that this video has cleared every single doubt of yours regarding fractured or broken tooth. If you still have any doubt, then kindly comment below and I will be happy to solve your doubts as per my knowledge. If you liked this video, then kindly share it with the one whom you care for. And for more such videos, like, follow and subscribe to my Facebook page and YouTube channel, Dr. Akash Shah. To subscribe, you can also click on my displayed image. Thank you for watching this video. Keep smiling. Stay healthy.